Hello, my name is Alyssa, and today I will be showing you Diabetes Project Part 1. So, a little bit of background information before we get into the diagrams and the project. I looked at a bunch of different diabetes databases in order to get an understanding of what was expected for this project. And one of the things that I found was actually from the National Institute of Diabetes and Digestive and Kidney Diseases, known as NIDDK, which classifies a diabetes registry as a standalone application designed to organize clinical information related to individual patients and populations. Now, many of these registries use summary sheets, which present general information, such as a medication list, recent labs, and can also include embedded guidelines. Now, after looking at the diabetes databases and doing the additional research, I decided to then set out and create my own database. Now, along with the different databases, I also looked at different papers that talked about databases and the information behind it. One of the papers that I found was titled Using Large Diabetes Databases for Research, which was by Wild et al., which describes some of the components of a diabetes database. This paper stated that the key criterion for a database in regards to diabetes is a valid diagnosis. Now, this means that there are some medical instances where it's not necessarily type 1 diabetes or type 2 diabetes. It is a little bit more difficult to get a distinctive diagnosis unless you are experiencing symptoms related to those medical instances. There are things such as hypo and hyperglycemia, which are similar to diabetes but not necessarily the case. Another important criterion is the duration of diabetes. This is also something that is sometimes hard to pin down. Now, this paper stated that in order to accurately determine how long someone has had diabetes, mostly they use the person's age to kind of pinpoint an approximate timeline, because sometimes it's really hard to determine when exactly someone has developed diabetes. Another piece of information that I use to make my database is a Diabetes Collaborative Registry data collection form. Now, what this is that it is a form that contains many questions that most healthcare providers would ask patients in general in order to gauge how to best treat them. Now, this would include the person's date of birth, their basic health information, but it also kind of goes into more of a detailed medical history, particularly in terms of diabetes. So they will ask things such as if you've ever had an amputation, what medications you're on, the frequency of those medications, family history, if you also have a history of cardiac problems associated with it, in particular some that are predetermined to go in conjunction with an actual diabetes diagnosis. So, using all of this information, I then set out to create my database for this diabetes project. So, my database contains 4 tables. As you can see, they are diabetic event, lab results, medication, and patients. The 3 that we will be focusing on are patients, medication, and diabetic event. The first table we will look at will be patients. Here you can see the 20 patients that I generated. I generated random names. I split between the sexes, so 10 males, 10 females, all in random ages, their birth dates, and their weight. I based weight to be relatively in terms of average weight for males and females, but like every human being that you meet, not everyone meets the standard criteria. So I tried to vary, like I said, with ages and weights to try to give it more of a realistic feel. Each patient also received a identification number to make sure that if information was listed for the patient in regards to that identification number, everything matched up. In regards to making sure that everything was connected the way that it should be, we will look at this diagram. 2 foreign keys were created in order to connect to the diabetic events, which is here, and the medications, which is here. Now, this was to make sure that the proper information is connected to the patients, along with the information that is generated based off the medications. So this is because patients typically, based off of the information that is listed, like I said, name, sex, age, birth date, and weight, can impact the medications that they are on, along with the dosage or frequency. The second table that we will look at is the diabetic event, which is listed here. Now, this table was created in order to address the information that Wild et al. Addressed in their paper about a proper diabetes diagnosis. Now, I had mentioned earlier that there are some instances where it's not a standard type 1 diabetes diagnosis or type 2 diabetes diagnosis. There are some instances where there are gestational diabetes, diabetic ketoacidosis, hypersmolar, hyperglycemic syndrome, or hypoglycemia in the severe sense. Now, this is because some people can experience events that are similar to diabetes without having a proper diagnosis, like I had stated, particularly in terms of gestational diabetes. Typically that goes away after pregnancy, and also these two, while they function similar to diabetes, they are not actually diabetes. Diabetic ketoacidosis obviously is a direct result from diabetes. Now, this table was included in order to help properly treat patients, since medical professionals will need to know what medication to give their patient based off of what they are experiencing. Now, while the medications might be similar and form similar functions, you might not give a patient the same medication to treat hypoglycemia as opposed to gestational diabetes, or vice versa. Same with ketoacidosis in terms of type 1 diabetes. This table is connected to the patient table by the patient ID, as you can see here. This is because the patient ID is associated, like I said, to a specific patient, and then this way the medical professionals will know what event they were actually experiencing, which will then help to determine the medication that they are going to need. Now, the diabetic event is connected to the medication table by the dosing strength. I chose this because based off of the event, if medications are similar, obviously some will be more severe than others, so the dosing strength might be differing in terms of that. The medication table was connected to the patient table by patient ID. This is important because the 20 patients listed, as you saw, all have specific patient IDs, like I said, that allow for healthcare providers to determine the dosage, the frequency, and to know when the medication was last prescribed. All of the medication information is based off of not only the diabetic incident chart, but more importantly, this chart here. This information is specific to each patient, such as weight, age, and gender, which are all important in determining the dosing strength and frequency, because these can have differing effects for each patient based off of those criteria. So not every patient is going to have the same tolerance reaction. One patient might be able to take a specific medication that helps them with their diabetic event, but if you were to try to give the same medication to another patient that might be, say, a different gender, a different weight, they might have adverse effects based off of their makeup. So it's very important that providers take into consideration these criterion, especially since you don't want to do more harm to your patient. You want to do as much as you can to help your patient. So these are very much important in terms of medication. So being able to connect all three of these charts, like we were able to, would be able to provide a good basis for a patient progress database, particularly in terms of diabetes. This is more of a simplistic form, but based off of the additional research that I did and also the criterion that was stated in different papers, particularly the paper that I found with Wild et al. They list these two in particular as being some of the most important criterion, especially if you are only giving a snap look into how your patient is doing. The prescription date and the dose based off of the diabetic event for the patient would give you kind of a brief snapshot of how the patient is doing. If the patient keeps having to have frequencies of their dose increase, that might mean that their diabetic event is negatively impacting their patient. So that shows that their patient is not in necessarily good health for their age and what they're experiencing. Now, if you were to say that the prescriptions were being refilled less and the dosage was also minimized after their diabetic event, that would mean that the patient might actually be improving. So again, this is a great basis to build off of, and the facility might be able to go into more detail based on percentages and other implementations that they want to add, which is what Wild et al. Was talking about, especially with the diabetic registries where they might focus on certain things, but that leaves room for improvement, as well as inserting different criterion that would help to address the certain situations. So this has been an overview of my diabetes project part 1.